HALLUX VALGUS bunions is an orthopedic disease condition. Look at this picture shows that normal and HALLUX VALGUS foot. Look at this. Then X-ray gold standard to evaluate alignment and severity. Look at this picture. Then MRI and CT rare used to assess joint damage or soft tissues. Look at this. A detail going on. Introduction. HALLUX valgus, commonly known as bunion, is a progressive foot deformity involving lateral division of the great toe hallux and medium deviation of the first metatarsal bone, forming a noticeable bump on the inner foot. It is common condition that may cause pain, discomfort and difficulty with footwear. It affects both function and aesthetics of the foot and can impact quality of life. A definition. HALLUX valgus is defined as a deformity of the first metatarsophalangeal MTP joint where the big toe deviates laterally towards the other toes and the first metatarsal bone deviates medially, leading to a bone bump on the medial side of the foot, commonly referred to as a bunion. Etymology. The term HALLUX valgus comes from Latin where hallux meaning big toe and valgus means turned outward or twisted. The word bunion is derived from the Middle English term bunionron meaning swelling or lump, reflecting the visible bump on the side of the foot. Epidemiology. HALLUX valgus affects approximately 23% of adults age 18 to 65 and over 35% those older than 65, with a significantly higher prevalence in females due to footwear and ligament laxity. It is more common in developed countries, likely related to the use of constructive footwear. Types. 1. Mild HALLUX valgus, slight lateral deviation of the big toe with minimal symptoms. 2. Moderate HALLUX valgus, obvious deformity with pain and difficulty wearing shoes. 3. Severe hallux valgus, significant deformity affecting walking, often involving overlapping toes. 4. Juvenile hallux valgus occurs in adolescence, often related to genetics. 5. Laterogenic hallux valgus caused by surgical overcorrection or complications or previous foot surgery. Causes: 1. Genetic predisposition to improper footwear, tight, narrow or high heeled shoes. 3. Flat feet, fees, planus. 4. Arthritis, especially rheumatoid arthritis. 5. Neuromuscular disorders, example cerebral palsy. 6. Foot trauma or injury. 7. Ligamentous laxity. Risk factors: 1. Family history. 2. Female gender due to shoe styles and ligament laxity. 3. Age, more common in older adults. 4. Occupational factors, job requiring prolonged standing. 5. Obesity. 6. Inflammatory joint diseases. Complications: 1. Chronic pain. 2. Bursitis, inflammation of the bursa over the bunion. 3. Hammer toe or cloud toe deformities. 4. Metatarsalgia, pain in the ball of the foot. 5. Calluses or Crohn's. 6. Decreased mobility and balance issues. 7. Footwear difficulties. Pathophysiology. Pathophysiology of hallux valgus, step by step process. 1. Foot biomechanical imbalance, abnormal foot mechanics such as over pronation, flat feet, or instability of the first metatarsal joint, alter normal weight distribution across the foot. 2. Medial division of the first metatarsal. The first metatarsal bone drifts medially towards the inner side of the foot, creating an imbalance in the metatarsophalangeal joint. 3. Lateral division of the hallux. Big toe. The proximal phalanx of the big toe deviates laterally towards the other toes, away from the metatarsal, creating a misligament. 4. Stretching and weakening of joint capsules and ligaments. The joint capsule, ligaments and tendon around the MTP joint become stretched on the medial side and contracted on the lateral side, further worsening the deformity. 5. Formation of the bony prominence bunion. The middle deviation of the metatarsal causes a bony bumps to form at the base of the big toe, the bunion, which becomes prominent and often inflamed. 6. Inflammation and brucitis. The overlying brusa become irritated and inflamed, leading to pain, redness, and swelling due to pressure from footwear. 7. Joint subluxation and degeneration. Continued pressure and missed ligament may cause partial dislocation, subluxation of the MTP joint and degenerative changes, osteoarthritis over time. 8. Secondary toe deformities. The deformity may alter foot dynamics, leading to hammer toes, calluses, crones, and pain in the adjacent metatarsals due to compensatory pressure shifts. This progressive cycle of mechanical imbalance, soft tissue adaptation, and joint degeneration forms the pathophysiological basis of HALLUX valgus. Signs and symptoms. 1. Visible bump on the side of the big toe. 2. Pain around the big toe joint. 3. Swelling and redness. 4. Restricted movement of the big toe. 5. Calluses or crones between toes. 6. Pain while wearing shoes. 7. Progressive lateral drift of the big toe. Diagnosis. One, physical examination, observation of deformity, palpation of joint for tenderness, assessment of gait and footwear. 2. Imaging. X-ray, gold standard to evaluate alignment and severity. MRI CT, rare, used to assess joint damage or soft tissues. Nursing diagnosis. 1. Acute pain related to inflammation and joint deformity. 2. Impaired physical mobility related to foot deformity and discomfort. 3. Disturbed body image related to visible deformity. 4. Activity intolerance related to pain during walking. 5. Risk for impaired skin integrity related to pressure point from deformity. Medical management. 1. NSAIDs for pain and inflammation. Example, ibuprofen. 2. corticosteroid injections in case of bursitis. 3. Orthotics, custom sew inserts, photospacers or bunion pads. 5. Physical therapy to improve flexibility and strength. 6. Footwear modification, wired toe shoes. Nursing management. 1. Assess pain level and provide analgesics as ordered. To educate patient on proper footwear and orthotic use. 3. Monitor skin integrity and prevent ulcers. 4. Provide emotional support related to body image. 5. Encourage adherence to non-surgical treatment. Treatment options. 1. Conservative, non-surgical, shoe modifications, orthotic devices, splint or toe spacers, physical therapy, pain management with medications. 2. Surgical options when conservative treatments fails. 3. Bunionectomy, removal of bony prominence. 4. Osteotomy, realignment of bones. Example, Severon, Scaroff or Akin osteotomy. 5. Arthrodesis, joint fusion for severe cases. 6. Epidemiology procedure, fusion of the first metatarsal cuneiform joint. Psychosocial medicine. 1. Body image counseling, help patients cope with appearance related concerns. 2. Support groups, facilitate sharing of experiences and coping mechanisms. 3. Patient education, teach realistic expectations and lifestyle adaptations. 4. Anxiety reduction techniques, relaxation methods and reassurance pre and post surgery. 5. Activity modification counseling, assist with adapting to physical limitations, avoiding social isolation. Prevention. 1. Wear properly fitting shoes with wide toe box. 2. Avoid high heels or pointed shoes. 3. Maintain a healthy weight. 4. Use foot supports or orthotics if at risk. 5. Perform Foot strengthening exercises. 6. Early evaluation of foot pain or deformities. In conclusion, hallux valgus bunion is a common and often progressive foot deformity that can significantly impact mobility and quality of life. Early identification and conservative management can prevent progression and complications. Surgical intervention may be necessary in severe cases. Multidisciplinary care, including medical, nursing, orthopedic, and psychosocial support, ensures optimal outcomes and improved patient well being. Thank you. Have a nice day.